My name is Connor Maginnis, and I am a third-year medical student at Louisiana State University School of Medicine in New Orleans, Louisiana. Today, I'm presenting a systematic review on the analysis of graft types used with internal brace augmentation for ACL reconstruction. I want to recognize the other authors from Tulane and Kansas School of Medicine who contributed to this paper as well. So ACL reconstruction is a very common procedure in the US, estimating around 150,000 surgeries plus annually. So there are new techniques being developed to decrease failure rates in these surgeries, and one such technique has been the use of an internal brace. If you're not familiar with an internal brace, it's essentially a high-strength suture tape used to augment the graft. And what we wanted to do was look at the effects of graft augmentation with an internal brace, depending on the type of graft used, whether that was a hamstring tendon graft, quadricep tendon graft, bone patellar tendon bone graft, and whether that graft was an allograft or an autograft. So we did this by conducting a systematic review of the published literature, and we were able to identify 10 studies which met our inclusion criteria, as you can see listed in the table here. Of these 10 studies, 5 used hamstring tendon graft, 3 used quadricep tendon graft, 1 used bone patellar tendon bone graft, and 1 used both hamstring tendon and quadricep tendon grafts. Most of the studies listed here are animal biomechanical studies, but we were able to identify a few human ones. Of the hamstring tendon grafts, we weren't able to find any looking at hamstring tendon allograft, but the hamstring tendon autograft showed promising results in both biomechanical and human studies. Biomechanically, suture tape augmentation decreased elongation of the graft, and it also increased load to failure and stiffness. In a human study, suture tape augmentation significantly reduced post-op laxity compared to just conventional hamstring tendon alone. As far as the quadricep tendon grafts, we found a study identifying both autografts and allografts, and they most notably resulted in higher post-op KOOS pain and function scores compared to patients who did not undergo suture tape augmentation. For bone patellar tendon bone allografts with suture tape augmentation, they showed decreased cyclic displacement and increased load to failure in a biomechanical study. Here, we weren't able to find any clinical studies on this model, but based off of results, we were able to conclude that hamstring tendon, quadricep tendon, bone patellar tendon bone grafts augmented with suture tape augmentation demonstrate an effective method for ACL reconstruction. All the graft types used with suture tape augmentation showed no evidence of clinical dysfunction, with some showing significant biomechanical or clinical advantages compared to conventional ACL reconstruction alone, which it would be without the suture tape augmentation. One of our notable findings was that hamstring tendon with suture tape augmentation reduced post-op laxity, which was not seen in the quadricep tendon group. But we recommend in the future that more research is required to better understand the clinical application of suture tape augmentation, just due to the limited amount of human studies. But this application should be considered for the future of all ACL reconstruction procedures. I see a question, Chad. Did you find any type of injury that suture tape did not work? Not on the ACL reconstruction, if you can clarify the question.